So my name is Alex Goodson. I'm a consultant maxillofacial head and neck surgeon, and I'm based principally on the south coast in Portsmouth, also working in Winchester as well. So my passion for medicine and ultimately surgery stems back to, as far as I can remember, when I was at school. I've always been into engineering and understanding how things work. I've always loved science topics, but at heart, I really like using my hands, and I've always been into design and technology. And so combining science as well as design technology and essentially manual labor, I enjoy combining all these skills, and that led to me becoming a doctor first of all. Did my early years training as a junior doctor and junior surgeon, and then I went to dental school to get a dental degree, so I'm a qualified dentist as well. And that then led me to enter the specialty of oral and maxillofacial surgery, where I get to enjoy doing some of the most fun, fulfilling, and enjoyable surgery I think there is you can do. Oral and maxillofacial surgery is a very unique and in some ways quite a niche specialty, especially in the UK. It requires double qualification, both as a doctor and as a dentist. So you have to do both degrees in medicine and dentistry. It allows you to do surgery principally focused on the head and neck region, and allows you to do a wide variety of very highly skilled and how shall I say, fine surgical techniques. It involves combination of soft tissue work, so the sort of the fine aspects of things like cosmetic surgery, facelift, blepharoplasty, but it also requires training in facial orthopedics, so the use of screws and plates to rearrange and repair or reconstruct bony structures of the face. And it also provides exposure to pathology of the head and neck, so things like salivary gland disease, benign lumps of the face and neck, as well as cancers. So my work ranges all the way from the smallest skin surgeries to the largest cancer resections and reconstructions. For example, reconstructing an entire jaw or part of the face using tissue from elsewhere on the body. So it really does give me a variety of surgical exposure, and it makes every case a different one. And that's what I love about it. I think the most rewarding thing about my job is seeing the dramatic impact I can make on patients' lives. And some of those patients come to me with life improving problems or things that require a small tweak to make a big difference. For example, rejuvenating surgery or dental implant surgery. It really improves people's quality of life. And some patients I treat, I am doing major cancer surgery for them, and again, massively changing their lives, saving and preserving their lives. There is no such thing as the perfect operation, but I always try to be as close to that as possible. There are several things that patients want out of a doctor. They need to be affable and able, most importantly. And there's a degree of flexibility needed on the doctor's side to work around the patient's ideas, concerns, and expectations. Ultimately, I think the most important thing, above all, is for the patient to be able to trust the doctor and the relationship that they can build together to get the problem solved. The thing I probably value the most about every patient I meet is that they're entirely individual. They all have specific differences, different ideas, and I love meeting my patients with a variety of personalities and interests. So I think it's the variety and getting to know patients on a one-to-one basis. I think one thing I would say is, and I've mentioned it before, there is no perfect surgery. There's no perfect operation. All operations come with risks and benefits. But I would say that as a surgeon, I do my best to get as close to perfection as I possibly can, and I will do everything I can in my capability to achieve the desired result for whatever the patient attends for and wants out of it.